A very good morning to one and all present here today. Today, I shall be presenting a case study on the non-surgical management of temporomandibular disorders. So without any further ado, let's dive straight into the presentation. So when we talk about temporomandibular disorders, what does the term temporomandibular disorder mean to us? So it is a term that is used to denote the collective group of musculoskeletal conditions that occur in the temporomandibular region. Now, these conditions, there are certain conditions which are characterized by pain, pain of the muscle of mastication, your TMJ, the preauricular region, or all of them as well. So this pain is one of the most characterizing features of the temporomandibular disorder. Talking a little about the anatomy of the TMJ, we see that it is a combination of two movements, the hinge action and the sliding movements. A little into the anatomy, we observe that the joint is covered by a fibrocartilage and is separated by a small shock absorbing disc, which helps in the smooth movement of this particular joint. Talking a little about the prevalence of TMD, we will see that we observe an increase in the TMD with respect to increase in age. At the same time, this is a variable epidemiology where we observe that it is a population-based prevalence, where we see that certain areas may get around 6% of prevalence, while some have 68% of prevalence in them. So what was the objective of this presentation is to demonstrate the effectiveness of the non-surgical management of TMD at an early age. So diving now straight into the crux of the presentation, I shall be talking to you about the case report. So we had a 6.5-year-old boy who had walked into our department with her chief complaint of grinding of teeth at night. The history of presenting illness was given to us by his parents for about 12 months, where they have spoken about associated headache, associated frequent headaches, and vomiting along with the grinding of teeth. Upon inquiring about the medical history, we get to know that they had visited the ophthalmologist earlier recently, and no relevant findings had been given forth by the ophthalmologist, and who further referred him to the dentist for further treatment. So looking into the past dental history, there isn't much of history of relevance. So the extraoral examination we speak about the TMJ, where we examined the TMJ, and it was there we observed pain on chewing and clenching. Then talking about the muscles of mastication, the muscles of mastication were observed to be tender. On intraoral examination, we observed that the patient did not have any caries, but attrition was observed. If you can see in the picture, I have demarcated the same with arrow marks. You can see that attrition of the maxillary and mandibular primary and primary lateral incisors and canines was observed. Looking at all of this, the provisional diagnosis was put forth as TMD with bruxism. Differential diagnosis for the same case would be migraines or other kinds of headaches, otalgia, and cervical pain. All of these three differential diagnoses were later cleared as follows. Migraines, we ruled out migraine based on a clean slate that was given to us by the ophthalmologist. Otalgia was run over clearance by the words of a pediatrician and an ENT specialist, and so also for the cervical pain. So now, how did we move about with, what was our plan of action for this particular case? So talking a little about the management of this case, we will be talking about, we have spoken to the patient and have gone through rigorous counseling sessions where we have started off by patient education, motivation, and biobehavioral moderation. So we have started off by breathing exercises in order to calm the patient down. Parent education and motivation was another form of therapy that was instilled. At the same time, an orthotic jaw appliance had been provided to the patient, which was a soft jaw splint. The entire goal of the management was to increase function, reduce pain, and to improve the quality of life of the patient. So as I would discuss about this case with you, I would tell you that this patient was referred to us with grinding at night. So the etiology for grinding or bruxism can be psychological or non-psychological in nature. So when we look at the psychological aspects of this, and when we have been through the counseling sessions, we have found out that there was sibling rivalry that had come into light. It was revealed. At the same time, it was pediatric comprehensive oral healthcare attitude, behavioral assessment of the patient, and counseling of the patient and the parent that played a very pivotal role in order to help us go ahead in this case. Now, during this, the symptoms were revealed and treated, and a treatment plan had been formulated for the same. A soft splint, like I had mentioned earlier, had been provided. So the applied knowledge of our applied sciences and in the various allied medical branches and their application and keen observation is what really helped us get to the bottom of this particular case. And it could have been done along with the aid of comprehensive treatment plan. So in conclusion, what I would like to tell you here is that since the TMD had been diagnosed in its initial stages, we were able to see the following very favorable outcomes. The patient was relieved of all his clinical symptoms. He had become more friendly with everyone, and the parents appeared cheerful and relieved as well. So the take-home message that I would like to share with you here is it is important for us to not only focus on the intraoral examination of the oral cavity of the patient as a dentist, but it is also important for us to keep in mind and focus on the overall well-being of the patient. So even that plays a very pivotal role. So thank you.